First question is, why did you get involved in public health?
Why did I get involved in public health? I got involved in wanting to help people with their problems. So I didn't really think of it as public health back when I was in my early days in college. I was going into being a teacher of the deaf. And I got married and had kids. And then when I went back to graduate school, I wanted to do something that was helping people. So I got into counselor education and dealt with people who had mental health issues and addiction, and became a therapist and did that for 12 years, with 2 of them being an administrator. And then when I moved to Florida, I got a job at an addiction treatment center. And so that's when I got into the nonprofit world, which in a sense is also working with the public health community, because we treat people who are of low income and have severe addiction and mental health problems. So I got into it because I wanted to help people, and the direction took, different paths along my long time of working in the field.
Oh, cool.
Yeah.
My next question is, what are the most interesting or challenging parts of your job?
The most interesting parts are, there's always so much to do and so much to learn, and I'm never bored. And it's something about learning about the human dynamics and how we interact and how we process things, and what creates our behaviors and why. I mean, it's just so interesting, and it's changed over the years, and it will probably change over the years when you get into the field, is that society changes, and so different issues come about in different ways, and research progresses to help us figure out really why does X happen to Y, or why does X happen to Z, and why is it different, and why is it the same? And it's just, so for me, that's the most interesting part of the field I chose, is that the human nature and human behavior are fascinating.
Mm-hmm.
The most challenging part for me right now is that I run a large behavioral health organization and a nonprofit, and it's always difficult and challenging to see and find people who are willing to fund our services. Mm-hmm. So we have federal funding, state funding, city funding, and then private donations and commercial and insurance, including Medicaid. So the financial aspect of it is very challenging. Another part that's challenging is working with staff and patients, and how things change. Sometimes very slowly, and then sometimes very rapidly, like right now during the COVID-19 pandemic. So that's very challenging to stay on top of it and to stay ahead of it and be proactive. Mm-hmm. So that you kind of have to have a telescope into the future to see where things are going, so you can be prepared for it when it happens.
Yeah. Cool. The next question is, how do you think COVID-19 is affecting the mental health of your community or people in the United States?
Well, I believe, and I know for facts because we have some data, that it's impacting people very seriously. This is a kind of a double whammy, triple whammy. So you have the virus, mm-hmm. which is very scary.
Yes.
Frightening, actually. And as you know, talking from a personal experience, it's very frightening. And from a professional experience, it was very frightening about how do I protect my staff and my patients from this virus as far as conducting business. So that was one area with COVID. But then also, so what happened because of COVID is now we have, 32 million jobless claims in the United States. People have, of course, lost their jobs, businesses have had to close, so bankruptcy filings are up. Some businesses may never reopen. And then you have the mental health issues that go along with these two very significant processes. COVID-19 wasn't caused economically, but it's a health issue, and then you have the economic issues. And one of them alone would have been frightening enough, but both of them together, I think, has really caused people to be very, very anxious, depressed. Some people can't get their medications or medication-assisted treatment, so they're using. So in our community, overdose calls are up by 20%. Domestic violence calls are up by probably the same amount. I don't have a specific percentage. A lot of depression, a lot of anxiety, a lot of burglaries. People breaking into pharmacies because they can't get their medication, or they can't get what they used to get on the street. Or some people, all our pain clinics closed. So pain clinics are a way that people get their pain medication in a regimented dosing, so that they can manage their pain and not overdo with their medications. And so it's really been very difficult for everybody. Providers, patients, kids, for the teens. I mean, the seniors lost their graduation, lost their prom. Colleges had to close. Young adults had to move in back with their families. So there's all these stress points that go on, and it just kind of trickles down. People had to stay home. That was stressful. I know that because I have been here now. It's going on my 9th week. And, you can't see your friends. We're social beings. And so not being able to interact with friends and family has been very, 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 very depressing and discouraging.
I have 2 more questions. So the next one is, where do you think there's the most need for improvement in public health?
There's so many improvements that could be made. Resources is the number one. And I'm going to talk about Florida. In every state it's different, but for the state of Florida, we are at the bottom of the United States as far as funding per capita per person for mental health and substance abuse. So we just, there's no money. And so as a provider in the not-for-profit world, who is a safety net for our community, it's just, our system in Florida, I feel, is broken in a way as far as the limitations on resources. How it works well is that as providers, we have a network of providers in this state who have absolutely, excelled during this COVID-19 process by pivoting rapidly and being nimble and flexible, and being able to create services for our patients without having to close down. So resources monetarily are very, very, need to be improved in our community. I think how we deliver services needs to be improved. And by that I mean, it's always been difficult to do telehealth because of restrictions with governmental regulations, and those were lifted because of the pandemic. And our telehealth is just, we moved from people coming in for outpatient services to total telehealth in 4 days, and our patients absolutely love it. The retention rate has gone up, the engagement rate has gone up, their participation in AA and NA meetings has gone up because it's all being done virtually.
Mm-hmm.
And so I think we need, in order to improve the system, we need to keep the regulations that were lifted, continue to be lifted, so we can provide the services.
Okay. Nice. And then finally, as you're talking earlier about how the coronavirus has impacted public health poorly with rates of domestic violence and mental health issues going up, do you have any ideas to combat those effects?
Well, what we're doing is trying to educate and get the word out that we're still open, trying to do, we have a prevention team that is working with adults and college age students and teens to, just kind of open up the lines of communication so people can talk about what they're feeling and knowing that it's okay to talk about it. The feelings are okay, that they just are what they are, and how to deal with them in a healthy way rather than by using drugs, alcohol, getting angry, and not using appropriate coping skills.
Okay.
So I think educating people in the community at this point in time is very, very important.
Mm-hmm. Okay. Well, thank you, Mimu.
Oh, that was it?
Yeah, I had my mom helped me prepare a couple questions.